All right, Nancy, I understand your concern about stroke and how this can be something that causes you to hesitate when it comes to seeking chiropractic care. I completely understand that concern because I was once in that boat too, and I didn't even get my first chiropractic adjustment till I was 26, and it was about a couple months before I started chiropractic school. So I understand that fear. But let me talk to you about some research that's been conducted regarding this concern, maybe help put your mind at ease. According to this study, both case and control data were extracted from the same source population, which encompassed National Health Plan data for approximately 36 million commercial and 3 million MA members. This is the largest study that's been conducted to date regarding this subject. A total of 1,829 cases were identified, making this the largest case control study to investigate the association between chiropractic manipulation and a vertebral basal artery stroke, which is what you're concerned with happening with that adjustment. Due to the nationwide setting and the large sample size, this study likely reduced the risk of bias related to geographic factors. And overall, the results really increased the confidence in the findings of a previous study, which concluded that there was no excess risk of the VBA, which is the vertebral basal artery stroke, associated with chiropractic care compared to primary care. Also, the results indicate that there is no significant risk of a VBA stroke associated with the chiropractic care as well. To further the investigation, they analyzed a number of comorbid conditions that have been identified as potentially modifiable risk factors for a first ischemic stroke. Comorbid conditions such as smoking, body mass, hypertensive disease. With the exception of hypertensive disease, there are reasons to question the clinical significance of these conditions and the occurrence of an ischemic stroke due to the vertebral artery dissection. A large multinational case reference study looked at the risk between the vascular risks between people that have a history of vascular disease, hypertension, smoking, hypercholesterolemia, which is high cholesterol, and diabetes, and as well as them being overweight or obese. First, looking at those risks, for that population for an ischemic stroke and the occurrence of cervical artery dissection, and only the hypertensive patients had a possible association with an odds ratio of 1.67. They had a 95% confidence about that, which is just saying that those patients that have a higher high blood pressure have a little bit more possibility to have a stroke, but that is because they have a comorbidity that they're dealing with. The stroke has been a subject of tremendous disagreement within and without the profession, with one prominent authority saying that there is at most a 1 in a million chance of such an outcome. And in order to prevent the risk, we use testing throughout our exam, different ortho tests. We look for specific red flags throughout our exam as well. That's designed to help identify if you may be one of the people that's susceptible to this type of injury. That way we can really further prevent that from happening. Does this help ease your concern? And do you have any more questions about this particular subject before we move forward?